Hello, everyone. Welcome back to Autism Demystified. I am your host, Dr. Vladimir Barayev, general pediatrician specializing in autism care for children, helping families navigate their developmental journey with confidence and equanimity. And today we have a very special guest who is joining us, Dr. Amanda Quirk. She is a pediatric physical therapist who specializes in pediatric pelvic floor therapy for children and teenagers. Her sessions are held at the comfort of a child's own home. She does home visits where the family can ensure proper carryover from all treatment sessions within the same environment. So she does it and parents can do it. Same environment. Beautiful. We love that. Typical conditions treated are chronic constipation, abdominal bloating, pain, gas, encoporesis, meaning pooping on yourself, having leakages, dysfunctional voiding, and daytime or nighttime urinary leaks. Dr. Amanda is native to Staten Island and has always enjoyed serving the community she lives in. She enjoys playing soccer, kickboxing, and spending time with family and friends. I don't know how she does it all. Dr. Amanda also enjoys anything outdoors and traveling. Dr. Amanda, welcome.
Thank you. Thank you for having me. Very excited to be here today.
It is my absolute pleasure to have you here today to discuss a topic that is on the minds of like 99.9% of the families that I work with, and that is constipation in kids, leading to all kind of bowel and bladder dysfunctioning. So I will let you begin by letting us know what do you feel is one of the biggest factors to why so many children are constipated?
Ooh, good question. One of the biggest factors. Okay, so what I tend to find is with every kiddo who has chronic constipation, every single one of them have weak cores. Postural muscles are all very weak, and that in turn can contribute to the chronic constipation. So specifically, the muscle that is the meat and potatoes of what I do and that I try to strengthen is known as the diaphragm. So that muscle is used in breathing, but many people don't realize that it is made with skeletal muscle tissue, which is the same way, to strengthen your bicep, to do a bicep curl, you could also strengthen the diaphragm muscle used in breathing. So typically for kiddos who suffer from chronic constipation, they tend to have a very weak core, very weak diaphragm, which tends to release a vicious cycle, and just contribute to more and more chronic constipation.
I see. And how about their diet and fiber intake? So is there anything in common that you see with kids in terms of that?
Big time. And water intake. Big time with water intake too. It's funny because, just even starting with the basics, water intake and fiber. So when, from the very first session, I go into, education about that. And I always like to ask, how much water does your child typically drink a day? And the answer I always get is, oh, they drink a lot of water. And then I will go into how many ounces of water is appropriate depending on the child's age. And they say, oh, no, we definitely don't do that. So it's just even starting with the basics. The water intake is never what it should be. So definitely emphasis on increasing fluid intake, and same thing with fiber, because children's diet, I know with my daughter, we run on pasta and fruit. She is a toddler, so it is very hard for certain kids to have the right nutrients they need, and especially foods that are good in fiber. So I also kind of go into a little bit of education with fiber, because there's two different types of fiber. There's soluble fiber, and then there's insoluble fiber. And what tends to happen with kids who have chronic constipation or encoparesis is we're not getting the right amounts of fiber, the fiber that's needed. So I usually recommend, soluble fiber is what draws the water into the stool. Insoluble fiber bulks the stool. So our proportions are not usually what they should be. So I usually recommend having 75% soluble fiber and 25% insoluble fiber. So, and of course, if families want more details of nutrition and diet, I usually refer to pediatric nutritionists if needed, if that's an area of struggle. So I just give the basics with that, just letting families know that there is a difference between two different types of fiber, and getting the right amount of fiber can help with the chronic constipation.
But now, how about as far as parents that ask me, oh, my kid doesn't consume enough fiber in their diet based off of everything you told me that contains fiber. I'll just solve this problem by going to buy some psyllium powder or some powdered fibers out there. And I have to tell these families that no, the best kind of fiber you can get comes from God's beautiful green earth. He made the magical fiber for you to consume. There's things called oranges and apples and pears. And broccolis and kale and a whole food plant-based nutrition that has tons of fiber in there for you with beans and legumes. You can I personally find those to be way better than something you could buy from a GNC supplement store. How do you advise families about that?
Absolutely. So what I try to say to families is, let's start small. We'll pick one. What is one fruit that your child likes? And if your child is also on board, let's just stick with that. We don't have to get creative with, trying too many different things if we know it's not going to work. If your child likes apples, let's have apples, and apples with the skin because the skin is also huge if we can. So we could puree apples, we can give it different textures, steam them, whatever the case may be. However, when cooking the fruit, we are losing some nutritional value. So just keep that in mind for families. So best case is pick one and let's start there.
I love it. Start small and work your way up. Don't try to reinvent the wheel. Don't make it hard on yourself, because it's simple, but that doesn't mean it's easy to do. But it is simple.
Right.
So
correct.
The subject that you brought up, which is what you specialize in, as far as muscle weakness, particularly with postural muscles that help with evacuation and stooling. Once families are working with a gastroenterologist to help with their child's constipation and a nutritionist, and they're still not seeing good results, their child is still having issues with constipation, even though it's being managed by multiple specialists already, how do you come in and help to save the day?
Great question. So when working with the gastroenterologist, typically what is recommended is Miralax or Clean Out, et cetera. But movement is also just as critical and important in treating constipation as anything you can get on the market. So that's where I come in. With physical therapy, it is physical. So we do a lot of movement, and just even exercises such as squats gets things moving with the bowels. However, that is more of a traditional physical therapy answer. So specifically for me, the pelvic floor therapy, where I come in, is, again, now with strengthening the diaphragm, we strengthen it both concentrically and eccentrically. So just to use the bicep again for viewers as an example, concentrically, bringing the dumbbell closer, that's concentric, we're shortening the muscle, and then bringing the dumbbell back down, we are elongating the muscle, so that is eccentric. So in terms of the diaphragm, taking that big belly breath in and educating belly breathing, because again, with weak core muscles, I tend to see accessory muscle overuse. So chest breathers, whatever other method that is not conducive, basically. That's not helping with the belly breathing. So with the diaphragm, we strengthen it concentrically with the big belly breath, get things in the bowels moving, and in turn with the pelvic floor, with those muscles. I have a little pelvis here. So I usually bring this to with my sessions. The pelvic floor muscles are like a bowl at the base of the pelvis here. And when you're doing a big belly breath, we are moving everything in the chain down in unison, and in turn, stretching and relaxing the muscles of the pelvic floor. Because also with kiddos with constipation, sometimes it does start with a bad bowel movement experience. They are traumatized from a very hard stool passing, and those pelvic floor muscles are not relaxed. They are clenched and cannot get the stool out and cannot relax those pelvic muscles. So the pelvic muscles, like I said, they are a bowl at the bottom, but they do sling around the rectum, and when it is tight, you're stretching a tight muscle and it's going to hurt even more. So going back to the diaphragm, big belly breath to kind of get things moving down, relax the pelvic floor. And then the big part of it too is when you're pushing the stool out, to not hold your breath, not brace and hold your breath and clench, because that's kind of what kiddos do. So big breathing out and relaxing while having the bowel movement.
Okay. And as far as helping children to practice these skills, how do you work with them? Can you give us some examples in the home?
Sure. So in the home, I do, if there is, for example, a fear of the bathroom, we will work in the bathroom. We will do all the fun exercises. I have a lot of fun books, fun poop-related games that we will work in the bathroom to make the environment less scary for the child. And then from there, try to work through that bathroom anxiety if that's the cause of the constipation. And then we'll also talk about toileting posture too. The posture on the toilet matters. I say the best thing you could have, your best friend will be a squatty potty. So definitely, getting that.
To help the muscles relax better? Is that what the function of the things like a squatty potty is?
Yes, it will help you relax better. It'll put your legs in optimal position to get things moving the way they should be. So definitely sitting with the squatty potty, legs elevated, knees bent, relaxed posture helps for sure to open the pelvis and to get the bowel, the stool out without pain, again, with the breathing. So, and then that's also, we do a lot of things to make it fun for the breathing, whether it's blowing bubbles, windmills, things, because it is pediatrics. So things to keep it fun and light, and that make sure they're not holding their breath, bearing down, just keeping it all fun.
Got it. So, to make it nice and loosey-goosey.
Exactly.
I noticed from personal experience, not to get gross, but I know for myself, whenever I'm physically active, like right after a jog or a walk, I feel like everything moving down there. All the guts are, the machinery is rocking and rolling. I
exactly.
have backup. So I totally, I've totally lived that same, lived your words that you're saying about preventing constipation before it even begins.
Yes. Movement is everything. So even going on a walk, every little bit helps for sure.
What? Now, I have heard from families saying, no, my kid runs around a lot. It's no problem, but they're still very constipated, and I'm not sure why. I just recently had them go to daycare, and they just finished toilet training, and then all of a sudden, all the pooping issues began. I have no idea where those could have arisen from. Proper English, arisen from. What do you think is the culprit in those types of scenarios? What have you seen?
change of environment, change of routine. Even, when a family brings home a new baby, anything that could be a break in that routine. Always, even this one, long car rides. So if a family is on a long car ride, they have to hold their stool in, and then it only leads to a vicious cycle because they're holding it in, they're still not their destination, they're not saying, mommy, daddy, I have to go, whatever the case is. And then the stool is only going to get larger, more compact, and then that could lead to the incident that started it all. So just any change of environment in general tends to agitate the vicious cycle of chronic constipation.
I want to second that change of environment, and that what I hear some kids tell me secretly, hey, Dr. Vlad, listen, this is what's going on, okay? The bathroom in the school is gross. I'm never going to go potty on that thing. I'll just hold it all day, and I'll wait till I get home. I hear that.
Right. And even I tell families too, if we need to bring a squatty potty into the school, what they have travel ones, whatever we need to do to help keep everything successful, because those toilets at school sometimes are not the greatest height for a child, so it's just not the right environment. Even the flushing, some kids will even say, when I flush, it's loud, it's scary, so they don't go to the bathroom because the flushing can be scary and loud to a child. Different echoes, the different environment.
For sure. And taking it back to soiling and encoparesis. So families have sometimes presented this question, and I could see the logic working in the mind, saying, how can my child possibly be constipated if they're having so many accidents? Like the poop just keeps coming out. Well, how do I know that's constipation at all? Why is that happening? How do we explain that to them?
So I go over the different types of bowel, the different types of stool. There's about 6 different types according to the Bristol-Myers scale, and that encoparesis.
Love that chart. It's beautiful.
Yeah, it's a great chart. It's a great visual.
Oh yeah, lunchtime.
Yeah, so it definitely helps families to understand what a normal bowel movement should look like, which would be type 4 or type 5. So with encoparesis, that is more of the type 6. That is a leakage. That is a constant leakage. So what is happening is the rectum is becoming overstretched and compacted. The stool just keeps bulking up, and just keeps stretching the rectum. And then liquid stool is just bypassing the hard stool and just at a constant leak. So that's kind of what's happening there for those kiddos with fecal leakage. So it's like not the right.
A hard rock and then things going around the rock and spilling out.
Exactly. Right. Exactly. And with those kiddos, I do show visuals. We do a lot of videos explaining what's going on, a lot of anatomy education. So that way they see what's happening. The family is on board. They understand what is causing that. And like I said, going over the different types of stools, that scale.
Sounds delicious. Thank you so much for all of that wonderful, amazing information and all of your helpful resources that you have shared with us today. How can families find you and work with you?
So through my website is probably the best way. So my website is apqpediatricpt.com. There is a contact form through there. So that's probably the best way to reach me, or my email as well, which is apqpediatricpt@gmail.com.
Okay, fantastic. And I'll make sure to include all of Dr. Quirk's information in our show notes at the bottom of this video. Thank you to everyone for joining us. And thank you so much, Dr. Quirk, for joining us to explain the wonderful work that you do and the constipation that happens in children and what we can do about it to manage it. It was such a pleasure having you today.
Thank you so much for having me. The pleasure's all mine.
As always, parents living in New York State, navigate autism with confidence. My name is Dr. Vlad, general pediatrician specializing in autism care for children. If you'd like to work with me, you can contact my office 24 hours a day, 7 days a week, 365. Our team will speak with you at the number 917-819-5056. Thank you to everyone and have a great day.